Welcome everybody to the September 2025 National Urban League Health Equity webinar series. We are delighted this month to really talk about a timely topic. And for those who do not know me, I'm Lydia Isaac, the Vice President of Health Equity and Policy here at the National Urban League. And we are here with this distinguished panel to talk about the future of vaccines and what we need to know in this moment. I'm so excited and really humbled and honored to have the folks on this call with us that took the time out of their day because they're so busy to talk to us. And so I'm going to have all of our panelists introduce themselves and a little bit about the work that they've done in this space, and then we'll get on to the questions. Please remember for the audience that there's a question and answer feature, so if you have questions, please put them in the chat and I'll get some done live. We'll get some done afterwards. And just let us know that if you have any questions, try to use that feature. And that's how we're gonna do this. And we also have time at the end for additional questions. So I'm gonna start with Dr. Shirley.
Hello, everyone. Such a pleasure to be here. Thank you so much, Lydia, for inviting me. Welcome to all the panelists as well. And my name is Dr. Hajar Shirley, and I am just truly delighted to be here. I'm the founder and research director for the Vaccine Equity Education Coalition. I've worked across healthcare, the healthcare ecosystems, starting within industry, from developing healthcare innovations to delivering services to our most vulnerable communities in my current capacity. As a researcher and educator, my current remit, I'm really focused on training our next generation of healthcare leaders through the exact strategies that we're talking about today. And through my leadership with VEEC, I really focus on fostering this essence of prevention and health equity through community-based partnerships. And I'm excited to share more about our programs. I've seen that prevention really protects our families. It allows us to strengthen our communities. And this is exactly why I'm here today. A vulnerability anywhere is a threat everywhere. And we know that infectious disease simply do not know borders. So I'm here to share what we've learned, and very, very blessed and proud to be here with everyone else. Thank you so much, Lydia.
Ms. Nagar.
Hello, everyone. My name is Aishwarya Nagar, and I'm a senior analyst at the Johns Hopkins Center for Health Security, which is in the Johns Hopkins Bloomberg School of Public Health. So here in Baltimore, if anybody needs Rex. My work focuses on improving regional public health preparedness and response, especially how public health would respond to public health emergencies. And my work also focuses on building trust in public health, addressing harmful and misleading health rumors, especially during emergencies and crises, and countering information manipulation campaigns. Specifically, right now I'm working on countering information manipulation around chemical, biological, radiological, and nuclear threats. I had a great time developing the practical playbook for addressing health rumors with a team. It was a CDC-funded project that we have now been working with different health departments on implementing in their spaces for countering any and all misleading and health or harmful health rumors that they're coming across. So thanks for hosting me. Thanks. I'm excited to learn from all of you. And yeah, over to Marcella, maybe.
Dr. Nunez-Smith.
Oh my gosh. Hello, everybody. I'm so excited to be here. And thank you, Lydia. And thank you to the National Urban League. And I really want to hover there for a moment. This is an incredible organization. I have deep gratitude and appreciation for all the work that you do, everybody joining the call today, being in conversation with us. You know, this is such an important moment for us to just take a deep breath, bring the temperature down a little bit, right? Just have some good, honest talk about health and vaccines and what's going on right now. So like everybody else, I feel really honored to be invited to be in this conversation, to share, to learn too. So I'm Marcella Nunez-Smith. I'm an internal medicine physician. I'm also a researcher based right here at Yale School of Medicine. You know, one of the things I'm most proud about, in addition to being brought into space one-on-one with patients and their families who are making these decisions about vaccine and vaccination, is getting to work with community organizations and community leaders to get the accurate information out there, right? Everybody who's joining the call today, you are trusted and trustworthy. And so we need to make sure that you have the information you need as people come to you with questions. And so that's a super important mission. I'm really happy to be here with that. And some of you I know from COVID time, I'm sure we'll talk some about things we've learned from COVID when I had the opportunity to work as an advisor to the White House with President Biden, Vice President Harris, thinking about our federal response, which really was all about that on the ground, hyper local connection with community to get people vaccinated. So looking forward to this conversation.
I love it. I love it. So I want to just start with the basics, because we are in a period right now. We were talking about a little bit before we started that when we planned this webinar, there's things that have happened since that we did not anticipate. And so I want us to really talk about, before we get to how do we get here, why is this even an important topic? We're in a time where, and I'm going to skip ahead a little bit, but we're talking about the different committees, and people are like, well, I don't understand why we get these shots because I haven't seen this. And I thought that was such an important statement, because I was just like, you haven't seen it because we have vaccines. But I think people forget why vaccines are important. So can we just talk about historically why we even have vaccine, why we set up vaccine mandates? What is the importance of this prevention? I love that Dr. Shirley talked about this preventive method in our communities, and anybody can take it, anybody and everybody.
Yeah, if I can just sort of chime in. Lydia, thank you so much for just allowing us to establish this foundation. And the stark reality is that if we think about this from a global perspective, every 20 seconds, a child dies from a preventable disease. And that equates to 1.5, over 1 million lives lost each year. And this is from a preventable disease. Vaccines have really changed the story for us. They've saved about 4 to 5 million lives annually. And just to put things in perspective, by the time we finish this webinar, the 60-minute webinar, vaccines will have saved 360 lives. And we absolutely know that the science definitely demonstrates this. And as I mentioned, infectious disease do not know borders. And it's so important for us to understand that we have to continue to push forward and continue to think about these realities. We are blessed to have not been so close to polio or to some of these smallpox, to these very scary diseases of our history. But the fact is that because we know that we're a plane ride away from some of our most vulnerable spaces. And it's so important for us to understand that vulnerabilities anywhere is a threat everywhere, which we have all witnessed since we've lived through this very challenging time.
Yeah, so well said. I mean, I would I think that's one of the great challenges that we all probably encounter, right? For many in their lifetime, they haven't really seen people suffer, and that's what it is, right? Suffer from these preventable illnesses. It's so critical that folks understand the technology, the platforms, and really the safety, right? And efficacy standards. When we talk about just public health basics, you're not going to find many arguments. Like, we're going to talk about vaccination, we're going to talk about clean water, right? There are just a couple things that are going to rise to the top. And vaccines, you get the highest return on investment possible, right? When you get communities vaccinated. And that's what's really important, right? Individuals as part of communities. Because vaccination to work, that's a we effort, okay? So we all need to be getting vaccinated to get that protection at the level of our communities. So I definitely want to assure folks that, in terms of vaccine development, the standards are quite high for what needs to be proven before we even get to these discussions, right? I know in the news now it's like when to take what, and right, we'll get into some of that too. And this, that's what's referred to as the vaccine schedule. But I think really important, the United States leading the way, but with, partners, there are global standards around what goes into saying a vaccine is safe and a vaccine is effective or works. So that, I think, also is often just a mystery to people. And I know kind of with COVID too, because it was to our credit and the credit of Operation Warp Speed, so quick that, there are all these conversations about, does it need to take a certain amount of time? Does it? And it's really about the resource investment together and meeting those standards for safety and efficacy before we even get to talking about things like the vaccination schedule. So to get to that point, We already do a lot of work, and thanks to everybody who participates in clinical trials, we'll get back to that, a shout out there, to make sure that things are safe and effective.
Yeah, I'd love to add to that vaccines are one of the most successful public health interventions we've ever implemented. I mean, crazy to have a conversation like this about something that's saved countless lives. I'm originally from India. I grew up in Delhi, and it's so interesting because, like, on a cultural level, I just feel like this is not hesitancy around vaccines just isn't a conversation I grew up being surrounded by. You know, you don't want polio, you don't want cholera, you at this point, like, you know, you don't want dengue. And so if I can take something to not get me there, not get me suffering, not have negative health impacts, I'm taking it. So it's interesting being in an environment where that conversation is a bit more nuanced and a bit different. But I do think that's a story for most people. We trust our doctors. We trust medical guidance. We do want vaccines. It's this very vocal kind of component that is, you know, rooted in honestly like understandable heuristics and understandable cognitive processes we use to process complex information. But really, it's like crazy because it's at the personal level and at the community level. There's just so many benefits to it. For ourselves, if we're thinking, look, I just want what's best for me, great. Vaccines are a way to fight off dangerous diseases without us having to get sick first. It lowers our risk of severe illness, hospitalization, long-term complications, death. And then at the community level, we're protecting each other. Like it reduces how easily disease is spreading between us, especially for folks who can't be vaccinated, either because they're fresh to the world, newborns or immunocompromised or what have you. So I just think it's like this interesting, just like collaboration between us standing up for ourselves and us standing up for our communities. That's kind of what the value of being vaccinated means to me, beyond just the science of it and the impact of it.
I love that. And I'm going to ask you a follow-up question, or both of all of you. So then how did we get here? Right? The reason why we're having this webinar is that now we have, I would say, more than the average person, like you said, more than the person who has an exemption because of autoimmune disease or allergies or a religious exemption, which I think everybody supports that. But we're having a widespread backlash against vaccinations. How did we get here? Why do we think we got here? And then we'll talk about some of the lessons learned, and particularly in communication. So I want to talk about how we got here, or how we think we got here. That might be a better question.
Let's all not go at once, right, Lydia? Yeah, this is such an important question, right? Sort of that really is it. How are we here? I know that as a physician, I would have to express, some surprise, right? I mean, I think sort of going through my training, right? I've been a physician now for over 2 decades. And coming through as a medical student, these were not the conversations that we were having with patients, right? It was definitely, I think, much more understanding and maybe some more lived experience, right? With these preventable illnesses, things like measles. We've kind of gone through the list today, and so I think that is a big part of it, is when folks don't have that primary experience with some of these illnesses. But I think there are probably some other meta, issues to get into around how we are in a time where trust is diminished in science, where folks are much more isolated in where we're getting our information. And because of that, much more vulnerable. I mean, we saw this in COVID with some very targeted disinformation campaigns. I have a fair degree of expectation and tolerance for just people having questions and curiosity, and there being some confusion, right? When science evolves and changes, that's what happens. And I think that's fine for people on their vaccination journey to have those questions. But what I think is very dangerous and unacceptable is when there is that intention behind spreading disinformation about vaccines. And I think that is a new threat. And I often, would say in COVID that the enemy was not SARS-CoV-2, right? The virus that causes COVID. the real enemy was disinformation as we were trying to think about how to keep everybody safe and well. So, I think there are both those. Have I ever had a disease, or I have known anybody with polio, with measles, the sequelae and consequences, but also, where am I getting my information from? And is that information really high quality and accurate? And that part I think is definitely different and new.
Absolutely. I absolutely agree with Marcella, and I just want to just chime in as well. I think some of the points just with regard to tech and complacency, very real. And it's interesting when we entered this space of really trying to unpack that exact question, Lydia, how did we get here? We started talking to a lot of school nurses and allied health professionals, so individuals that are right within this space. And it was so humbling because I immediately realized that this whole essence of vaccine hesitancy or just mistrust, this is a decades and decades long sort of journey that has gotten us to this point. I think the conversation was at the forefront of our minds during the pandemic, right? Because we were all experiencing this, and this really became very real for all of us. But in talking to our allied health professionals and school nurses, et cetera, those religious exemptions were there for some time. We started to see these numbers where a lot of that first dose metric of measuring exactly when children are getting those first doses or no vaccines at all, that those numbers really started to really creep up. And when I think about this essence of we're all here because we believe in vaccines confidence, right? What does it mean to be confident, right? And I think that is the antidote to the question, Lydia. It's like, okay, so how do we get here and what do we have to do? It really comes down to really understanding that confidence in terms of, yes, let's actually take the time to talk about how vaccines work, how vaccines are manufactured, why we were able to really expedite the timeline for COVID. What is the whole process? I think we really neglected the communication components for a long time, taking for granted the essence that people really need to understand the science. I think convenience, access is also another thing. So what we're seeing now when we institute these changes of requiring prescriptions or making access very challenging, the reality is that, social determinants of health exist. So affordability, access, making this convenient for our families, that will actually have a negative correlation to confidence as well. And then Dr. Nunez-Smith mentioned complacency. We don't talk enough about the history of smallpox. We don't talk about enough the history of polio. And it's really interesting because I've had the privilege and blessing of speaking to a polio survivor through my work with Shot at Life with the United Nations Foundation. And when you actually speak to individuals, when you travel to different parts of the world where individuals are literally lining up because the barriers are real. Mothers are desperate for vaccines because they realize the risk and just the the health outcomes without these vaccines. I think it becomes very real. So part of what we've done with our youth ambassadors, we implement curriculum where we spend a whole module on the history of vaccines, showing them pictures of smallpox. And I tell you, it was really one of the conversations that I had with the school nurse in Newark, New Jersey. And she just said, we need to show what does measles look like? What does smallpox look like? So really embedding how were vaccines created, really, really spending that time talking about the history and embedding that within the curriculum and allowing us to really start to address that whole essence of complacency. When we see cases in New York City, it's like, okay, time for us to get the education components in gear. And I think all of this is really situated around this continuous education and building trust.
Now, I think that's really important. And I'm going to go to Aishwarya in a second because I do want to ask you questions about disinformation. But it's interesting because our president and CEO, Mark Morial, always talks about how he remembers standing on the line to get the polio vaccine, right? So there is a generation that does remember what it was like. And even me, I'll age myself a little bit. I remember what it's like to get chickenpox. I remember getting chickenpox. I got it twice. I got it as a baby because my brother was 3 when I was a newborn. And he gave it to me. My mother was like, we thought you were going to die, right? Because I was too young. I mean, they didn't have a vaccine back then. And then I got it as a first grader, mild because I had already had it, right? But my niece and nephew who are in their teens don't even know what that's like because you know, our generation, I believe, remembers what it's like to have people who have chickenpox when you were like first or second grade. But the new generation, which is actually wonderful, have no clue because there is a chickenpox slash smallpox vaccine. So I think that's a really good point about seeing it, understanding what that means, and knowing, you know, how bad it can be. And, you know, you remember parents are just like, oh, a kid got chickenpox, everybody got to stay home. You had whole classes that were had to not come in because of a chickenpox outbreak. So I think that's really important about understanding what we're preventing. And that's always been the I want to say the gift and the curse of public health, right? You can't see what you've prevented. And so it's very hard for you to argue for something you can't see. But Aishwarya, I want to talk about disinformation and the work that you do and you have done on thinking about how that spreads, why it spreads, and how we can combat it in this moment of how did we get here to get us, hopefully to get us out of here.
Yeah, I think so the work we do looks at this like circulating the situation of circulating information from multiple perspectives. When we're talking about vaccines, you know, initially there's maybe questions and concerns. At some point, there's rumors, which there's nothing wrong about that. Rumors are how we make sense of the world around us. Think of like I gossip with my friends. That's how we make sense of what people are doing, what people are saying. But when, you know, there are information voids and that kind of festers a little bit, that gap can be filled in by false information, maybe even partially false information. So that's misinformation, and that aspect gets more and more, it's just harder to disentangle. And then further down the line, we then end up with disinformation, which is when folks intentionally spread false information. And so I just think that like throughout the spectrum, there's very different approaches we need to tackle such a complex problem. So the work that we're doing around disinformation and information manipulation campaigns, it's hard because we know that the intention, there's something off about it. So it's more about building resilience to disinformation, identifying what are some tactics that are often used to deceive us. What does deceptive information look like out there? For example, if you read a headline or something that immediately provokes this like immediate emotional reaction, then like that's kind of the marker I use to be like, okay, something's going on here. Like this is making me feel really strongly in a really certain way about something I may not know as much about. So things like that, identifying tactics being used to deceive us is great for kind of that aspect of things. I think it's more complicated to then live on the other side of the spectrum where things may be true, may not be true, may have a kernel of truth to them, but they've been misrepresented or manipulated. So Dr. Shirley was talking about like putting ourselves in the shoes of the people who are experiencing this. And that's something I've had to do to just sort of like understand what's going on, because rumors, misinformation, I think are rooted in completely understandable human traits. If you're a parent and you know you're a new parent, you want to make sure your kids are safe. And if your thing about, okay, I'm just gonna go find accurate health information is like, okay, I'm gonna Google, the top 10 hits you might get would be like, could be conspiracy theories, could be completely bogus information, could be inaccurate information. And when there's just so much information to parse through, it's easier to hang out with like these sticky false kind of rumors or false claims that are going around. They're easier to process than something as complex as like, well, you know, there are some side effects, but they're not always, you know, and then we like screen for them and things like that. So I just don't think like amplifying accurate information or filling information voids is enough, even though that is the territory we live in. That is like not, it's a less resource intense approach. Like, look, if I just give you accurate information, we'll get you there. However, some things are so sticky that we do need to refute them. We do need to show how they're false, what the fallacy is, and what the reality is. And one of my favorite approaches for doing that is pre-bunking, which is preemptive refutation. Interestingly, it uses inoculation theory to sort of like find its impact, which is if I tell you about the tools that'll be used to deceive you, if I forewarn you about the type of false claims that you could expect to see anytime maybe a new vaccine comes out, or you know, measles cases are going around and we're talking about vaccines again, then I can make you more resilient to these false claims by reducing your susceptibility to believing in them. And then of course, folks have talked about it, health literacy I think is like an incredible sustainable long-term effort that we see, you know, public health practitioners, folks everywhere doing, where, look, if your issue is that you don't understand how we test vaccines for safety and efficacy, you don't understand how we report adverse events, how we make sure that we have these review processes, then let's explain that to you. If you're confused by why COVID vaccines came out so quickly, great. Let's chat about how emergency use authorizations work, or how we use pre-existing mRNA platforms and that technology to then develop these vaccines. It's just a complex interplay of like where on the spectrum you are between kind of the level of false information or like intentionally spread false information you're living in, and then just the resources you have to either just like, look, I'm going to get you accurate information, or let's focus on these like norms shifting, long-term sustainable kind of changes. I'll stop there.
No, I think that's great because you just gave me the alley-oop to talk about what I think Marcella was getting to earlier, and what Hajar was getting to also is, so how do we know vaccines are safe? If we're going to talk about it in this moment to make sure that our communities understand, how do we know vaccines are safe? And I would love for somebody to talk about the COVID vaccine. We've actually talked about this here before, but I agree with what you just said. You can never repeat it too much. So how do we know vaccines are safe?
So I'll start. I'm sure we're all like, you know, just eager to have this. We've all had this conversation. I mean, I was just harkening back, and, you know, even maybe I'll take 1 second before I talk about how we know they're safe to say that for all of us in this moment, showing up with curiosity and respect for people who have questions is just fundamental, right? So I think for each one of us, you know, I can have this conversation 10,000 times. I'm happy to have it every single time. And I think, you know, given all that we know, it behooves us to have patience and respect and be judgment-free, right? When people show up trying to navigate what is a very complex, complicated information landscape. So I thank people in advance for all the grace that you show your neighbors and your friends and your family and yourself, right? As you're trying to make sense of all of this. Yes, so there are very rigorous standards in place, right? For new therapeutics, so any new therapies, any new drugs, any new devices, and yes, any and all new vaccines. Vaccines go through before we even know about them, they are getting tested. So we have this whole spectrum. We talk about these phases of clinical trials. It starts early on. People remember from high school bio, you know, working with animals and others. A lot of this science begins in animal models, right? Where we first start learning and testing some of these interventions and vaccines. So at each of those, there are standards, right? Metrics that have to be met. This is a very, very robust scientific framework for moving on from each phase to the next, right? Because very early, we have to start demonstrating safety first and foremost, right? Before we get to humans, before we get to anything like that, you have to show that it's safe. And then you have to make, you know, you have to test to make sure that it works. So these multiple, it takes time, right? So that's important to say that this is, you know, I'll make a plug for our country's investment in science, because this is how we are able to build upon that foundation. It's from those early stages, basic science, right on through to translation to be able to get those data. So by the time an application comes in to the FDA in the United States for a vaccine, these things have been through the ringer, okay? Like been through the testing. The bar is high. You cannot just sit in a back room somewhere, but you are producing the report, okay? So this is real. And then there are experts at the FDA. So I know we talk a lot about the advisory committees and panels, and we might have some of that conversation today too. I think people have to understand all the different folks who inform this, and also lift up the people who their career is working at places like FDA and CDC. And so they have a lot of expertise in how to evaluate that report that gets submitted, right? And so that is yet another step before going to some of those advisory committees, before thinking about whether or not the vaccine has met that standard. So we can often hear about something and then we're like, oh my God, I've never heard of mRNA vaccinations before, right? And that's totally legitimate. It's to us to come and say, oh yeah, this is 20 plus years in the making, longer, right? In the making, this science, this technology, this platform. and why we saw this accelerate. And I'm really proud of our country. I will shout from the rooftops for Operation Warp Speed that we were able to put all those resources, right? I say when we're rowing in the same direction, like, look what we can do, right? So everybody's saying we're gonna find the vaccination options for SARS-CoV-2, meant bringing not new science, right? But taking that science that we already knew worked and putting it into, into the packaging of a vaccine and vaccination in an accelerated timeline. But I get, right? I have a lot of patience for folks who have these questions, and I think we should all be arming ourselves with those answers. So I'll let others talk, and we can talk about the advisory panels too, and some of those approval processes. But I think the top line is always, none of this happens without many, many, many smart eyes, right, on this, evaluating the science of this. And I guess in a other maybe cynical way, I would say it's to no one's benefit to put vaccinations out that are not safe and are not effective, right? So just think, there's no business imperative to do that. There is no public health, right, imperative to do that. So there are lots of motivations there. If anything, the default is it's not ready, right? The bar is really high to make sure a vaccine is ready.
I think Marcella just explained that so well. And the only thing that I would just chime in to add is just the surveillance. I think that development process that Marcella mentioned is, yeah, exactly, just so well explained. But the monitoring and the surveillance, I would say, is the monitoring surveillance, that's the added sort of control mechanisms to make sure that we know that the efficacy, safety, all of those high standards that Marcella just mentioned are upheld. So the reporting systems, having physicians, our allied, our healthcare providers, our patients, having access to say, look, if anything, if there's any adverse events or adverse effects, we have a system, a very sort of regulated, robust system to track any effects and impacts. So this is, I would say that control mechanism, that adds to that strong foundation, that clinical trial or that rigor that Marcella just explained. And then we also have data to substantiate any impact that could be reported, because we have strong surveillance and monitoring in place.
And I will add, because we, just for this point, the one, Operation Warp Speed was under the current administration first time, right? So we can do it in kind of bipartisan, nonpartisan, and what's right for the country ways. I just think it's important for us to mention that, and should be get credit for that, because that
Yeah,
was
I'm really glad you say this. That's why I say
Yeah.
I'm the first one, right?
Yeah.
To say thank you to Operation Warp Speed, and given our conversation today, also, like, thanks to many people on I know who are joining us today, were part of holding, OWS and everybody accountable for having representation in those trials, right? Which was really critical too. And one of the questions I would get asked the most, specifically around COVID vaccines, is, could I see myself in that trial? Like, who was in that trial? Who was this tested with? And so that's why it's really important for us to have those standards too, to make sure that we can always answer yes and say, it is a representative sample of folks who have been part of that scientific discovery. And that was achieved under OWS. And so that, kudos.
Yeah. No, I think that's, and I tell people, I was the first to say when it first came out, I was like, oh, this is too fast, because I know what the FDA process was. And then I actually, exactly what we said, I went and read and said, how did they figure this out? And part of it is that they did phases simultaneously. So the phases, they didn't skip phases. Is that back in the day, you had to do phase 1, 2, and 3 concurrently. And this time, particularly for the bureaucratic stuff, they did things simultaneously, but every phase was done. And in our education, we've been very upfront about saying that, like, every phase happened. They just happened quicker. Because also we didn't have the kind of the clutter of the world, right? Everything stopped. Everything else was pushed to the side. A lot of other things were not being considered, so that every scientist, every bureaucrat, every person who's working in the government could focus on getting this done. And it was a success. And I think Dr. Nunez-Smith, it was really important to show that that was a success. And so what I want us to talk about now, because I think, Dr. Shirley, you made a really good point about the monitoring is, so now we have these committees that everybody's hearing. Everybody's hearing about ASIP, everybody's hearing about different committees. Everybody's hearing about what the Secretary of Health is saying, what the CDC director has to approve. Can we talk about now, because this is not just about the COVID vaccine, which we know is an important one, but this is about now the whole vaccine schedule. So it's talking about flu vaccines, it's talking about RSV, we're talking about childhood vaccine, which for parents, and I think, I think we talked about earlier how important, when you bring a new child into the world, all you're trying to do is keep that child safe, like the joke is, I just want to keep you alive until you're 18, right? Like, because that is my job, right? And so when we talking about childhood vaccination schedules, can we talk about one, how that gets approved? What happened? Let's talk about, I think we have the time to talk about what happened and why there's so much confusion about what's happening. And what should parents and all sorts of folks, because we also think about shingles, we're thinking about different kind of vaccines, should be thinking during the season. We're about to get into flu season. We just had a COVID spike in the summer. We're seeing it go down, but we don't know when it's going to come back. Possibly RSV season. So what do people need to know about like what these processes are and what they're hearing on the news?
Pick one, pick someone. Who do you want to start us off?
Aishwarya, do you want to start us off to just think about that and how people are I would say metabolizing or understanding this news that's out there in terms of like information?
Yeah, I'll leave the technical specifics to the doctors in the room, so differing to y'all on that. But actually, so we've been working with state and local health departments for the past year plus on how, like, what they could do to feasibly counter misleading and harmful health rumors in their communities. And school immunization has come up consistently as something like, I just don't know what to do about it. And again, technical specifics aside, the thing that I grow increasingly concerned about, but also 100% understand, is lack of trust in institutions. You can tell me I need to do this, this, and this to keep my kids safe. You can tell me, hey, it's fine, don't worry, this is tested, everything's okay. But if I don't trust you, nothing's happening here. And honestly, some people have good reason to not trust public health, healthcare, government institutions. There are historical medical injustices that have taken place. Folks feel extremely left out of mainstream healthcare, and people have different relationships with how much they trust the government. So I think no matter what we do with the technical specifics of you should get vaccinated because this or that, at the back of our mind, we should constantly be thinking about how can we build public trust in institutions that do this work. But I think maybe more importantly, how can we improve our trustworthiness? Because if I'm not demonstrating transparency, if I'm telling you something point blank, don't worry, it's safe, which public health never does, but in your head, like you've heard some family friend had an allergic reaction or had a side effect or something, you're like, no, this person's lying to me. Things like that, I think, should constantly be in the back of our mind, is like fostering relationships is important for sort of making the information we put out there, like improving its uptake in the first place. But technical specifics, over to the doctors.
Before we go to technical specifics, though, but there has been some concern. What you just said, which is wonderful, and I agree that it's about trustworthiness. But there have been some concerns that we almost like we over explained or overemphasized the adverse effects, and that therefore did the opposite, where it said, it was like, well, why am I taking this then if you're going to tell me all these other things? So how do we, from an information standpoint, make sure that people are seeing the transparency, understanding what could happen, but also understanding that the counter, which is the good overrides the bad. It's like, it's like those, we have the funny story about the commercials that all the pharma commercials on the bottom is like all the side effects. And it's like, you're going to go blind, you're going to have incontinence, you're going to do all this other stuff. And you're just like, well, why would I take this drug? And it's because they have to put it there. So I just want to talk a little bit about that, because I think that's important. I think this is what's happening in this moment also, is that we've almost overemphasized the adverse. Oh, well, it looks like Dr. Shirley wants to answer, so I'll let Dr. Shirley answer. Yeah.
No, I think it's such a profound question, and there are sort of discussed communication strategies that we can all learn from, and that I even lean on when training our nursing fellows and our allied health fellows and students and ambassadors. I think the first thing is just acknowledging that really having tailored messaging is so critical. And there are differences and concerns. Like you said, it's almost like we're over communicating, but tailored messaging is so important, really focusing on specific concerns of each demographic. So we've talked to mothers, pregnant mothers. We've designed sort of objectives for our infant maternal, to our pediatric parents, to our older adult communities. And it's critical to really sort of focus on what is a chief concern, what is a specific question or concern for this patient or this community or this demographic that I'm speaking with. I think starting with sort of acknowledging that chief concern in conversation through tailored messages is important. And then also just sort of talking about which resources, like what are we all doing to sort of keep ourselves abreast of this dynamic changes, Lydia, for your other question, everything that's happening, how can we even sort of keep abreast of so many changes with this current landscape that we're in? And then going back to the science, right? So going back to what we know based on the studies. So we know that there was a lot of concerns of mothers who haven't started families yet on the COVID-19 vaccine actually impacting infertility, right? So this is an opportunity for us to address this myth, right? And to debunk it, but then also really talk about where and how, breaking down the science to explain that. And then I would say closing that tailored message with a strong recommendation based on science seems to work. But I know that just really the Urban League, like we know this whole power of trusted messengers, but really focusing in on tailoring those messages and treating our conversations. It's an opportunity for us to really get down to that chief concern and to really have these aha moments and really lay that foundation where we're building confidence.
No, I love that. I love the chief concern because that's usually what's underlying and sometimes it's hard to get at. Okay, Marcella, let's talk about ACIP and all the committees and all the things that need to happen that people don't understand what's going on.
Yeah,
And I use the acronym on purpose because I want you to talk about what ACIP means.
Yes, the Advisory Committee on Immunization Practices. So, this is a very thoughtful framework that has been established for, around, to your point, all the vaccines. And I'm so happy that you're giving us a flag for, the long list, and we're heading into, winter. And so a number of opportunities here for vaccination and protection, ranging from influenza, pneumonia, RSV, and then of course the pediatric vaccines and schedules. So it is a thoughtful system that's been put in place to make sure that we are getting all of the kind of knowledge and to have advisors come from outside of the U.S. government to help give a perspective. And so that's why these committees, have been formed, and that's why they exist. And it's always been around. It's always been a great honor to be frank, to be invited to be part of that process. And so people would really just, a pinnacle of their careers to be invited to be part of any of those advisory committees. And they are advisory. So, the recommendations that are generated there, will go. FDA has parallel committees, VEEC and others. And so either to the FDA commissioner, to the CDC director, where ultimately the decision is made and the recommendations are put forward. So I don't want people to question why that system exists, right? This is why it exists, to bring all the talent together. There's a lot happening now, though, right? There's a lot of dynamism and fluidity in terms of kind of how that process is working, right? Are things going, to your point before, are they going in order? Are people having enough opportunity? A big part of these committees is often the public comment and other sections where others can come in and contribute too. So it is hard to keep track, like who's on the committee today? What kinds of things are being considered? Why is that on the agenda today versus something else? So there are many questions. I know it's hard to follow. And I actually don't think it's important for everyone to follow, right? I think what at the end of the day, people need to know is where can they go to get really good advice and information, right? Others of us will follow and pay attention to the committees and weigh in, right? But at the end of the day, I'm a parent too, right? And I'm a daughter. And so I'm trying to understand this even on a personal level, right? For my own family, where are the recommendations? And this is a chance where I think there's a moment to spotlight and lift up other really great resources too. We have professional societies and organizations in this country where the expertise is as well, right? And so I would say, you know, if you are thinking about pediatric questions, just remember that you have, you know, the American Pediatric Association, right? Like, remember that you have the American College of Physicians. If you're looking at adult vaccines, like, you have these sources. And I would just stress to people, you know, we encourage folks to do this. We have at our fingertips the internet. So look at everything. Look at the guidance that's coming out right now from the vaccine schedule, certainly from the federal administration. Also look from the associations. Again, these are the specialty associations. These are the physicians who are caring for the patients and administering the vaccination schedules. Pay attention to that. Also, you know, I'm such a hyper-local person. I always am. And we have state, local public health departments as well, where this expertise lives. I know here, I'm based in Connecticut. We're part of the Northeast Alliance, where several states have come together to also help clarify where the science is on the vaccine schedule. So people who are listening, you know, your state may be part of one of these alliances, but also everything is very public facing. So you're free to look at any of these alliances that have been created and see what the vaccination schedules are. So I want to make sure, because that's the question I'm getting really now more than anything is, where can I be looking? And so I think we're very fortunate to say, oh my goodness, no shortage of people in this country who have expertise on the safety and efficacy of vaccinations. And we need to make sure that people know where to go get that information in a way that's easy for them, right? So I'm not going to send you to PubMed to read all the original science. Just know that there are other people who have done that already, you know, and you can find them with some of these alliances and through these professional associations as well.
Okay, that's a fantastic answer. It merges with a question I was going to ask, is where do people go for the right information? And that is, you have to find other sources, because right now it may not be the CDC. It may or may not be.
Very much in flux. You know,
Yeah.
I want to say, because I think it's important, you know, we have always been, I've always been proud to be a American physician, right? And a public health practitioner, because we have been seen as a leader across the world. And I think this is a really important thing that might be beyond the scope of our conversation. But, you know, we've mentioned it here, like, if you want to talk about something where all of us are invested, it should be in vaccinations, right? Around the world and the globe. And, you know, and I do feel strongly that we need to build trust in these institutions again, right?
Mhm.
We are in a period of great flux and uncertainty. So I would say that, you know, we're taking deep breaths today. We're bringing the temperature down, right? We're going to see, you know, these institutions have long histories. Everything evolves and changes. And so I don't say to folks, you know, not to go. There are other important things that are coming out of the CDC and federal government and regulation. So I don't want to say to people, you know, that you can't go to any of those sources, you know, anytime. I would say in this moment, because there is such flux, right? Where can we go where there's stability in that information? And you also have the security in the science driving it. And so we are fortunate to say, hey, you can check out what's happening, CDC, stand it up next to, you know, what you're seeing from these professional associations, stand it up next to some of these alliances, and please, please, please talk to your provider, right? This is why we are here. And I want to say, because people often are like, we don't want to bother you. This is what we do. We want to be invited into that conversation and in the space with you on your vaccination decision journey for yourself and your family. So reach out to us as well.
Fantastic. We actually have two questions in the chat that I think are applicable to this conversation. And one is, yes, Angela, we will, as we're talking about the resources, put the resources when we send out on the bottom of the YouTube. So one of the questions was, can we put those resources so that people know where else to go? But the other question, which I think is a really good one, which is related, is even if we find these resources, sometimes, even if they're not as bad as PubMed articles, they're not that accessible to people who don't have the same amount of health literacy. So are there other plain language resources that we can think of? And I think well, let me not say, I don't know who's going to know it, but plain language resources that we can point people to also.
Yeah, I think it's really interesting because part of this conversation, and mostly with our youth ambassadors, in the process of building this essence of health literacy, we talk about, and I think Ms. Nagar really touched on this as well, this whole essence of discernment, right? We have really focused on allowing our ambassadors, our youth ambassadors, to really understand exactly that, how Dr. Nunez-Smith mentioned, talk to your provider, talk to your school nurse, like who are those trusted sources of truth? And how can we build this essence of discernment of knowing when a source or a resource just does not make sense, where this just does not look right, and making sure that our students, our sort of healthcare decision makers of the future, can also sort of build this skill set. But I think that embedding very simple information into sort of like curriculum, into our courses, like our health courses, and really sort of emphasizing this whole essence of communication, health communication, and information, to the extent that we can also empower our school nurses. I mean, they are there, just as Dr. Nunez-Smith mentioned. Yeah, talk to your healthcare provider. The wonderful stat that I always sort of share with my nursing students is the fact is that 80% of parents, in numerous studies, a large number of parents still say that their decision to move forward with vaccines was positively influenced by their provider. So we know that our healthcare providers, our nurses, our doctors still hold such an influential position, right, with parents to decide whether to vaccinate, right? And then sort of going into these conversations with presumptive, like, yes, everyone, Lydia, like you said, we want to keep our children safe. So let's actually start from that perspective. But I think that really allowing our school nurses, going back to your question, allowing our school nurses to really simplify and provide these very simple resources. And it's changed. It's changed. It is beyond. I love that Dr. Nunez-Smith mentioned, yeah, let's actually look at diverse resources. And it has expanded. It has expanded beyond the CDC. There are videos, there's different educational materials that we can share with our kids. How do you know you're sick? How do vaccines work? What happens? What's the difference between virus and bacteria? So these are resources that we can even arm our frontline sort of leaders to make accessible to our parents, to our students. And it's never too soon to start to talk about what does it mean to be sick and what are some of those preventative measures that we can do to keep everyone safe.
Yeah, I'd love to add to that, well, first of all, I think anyone who's communicating anything about science should have a plain language version of what they're trying to say. I would say publications as well. If you're on PubMed, I would personally benefit from a plain language explanation of what people are talking about. And that's how we should be communicating. Scientists do science. We're not always trained to communicate, right? So like, first of all, that norm, setting up that expectation that whenever we have complex things we want to share with people, we do our best to communicate them in plain, simple, easy to understand ways. This just should be a norm, flat out. In addition to the incredible resources that Dr. Shirley and Dr. Nunez-Smith have shared, there's another kind of stakeholder emerging in the conversation. Look, the more we democratize information, the more chances there are that there are false claims that'll slip through, and nowhere have I seen that more evident than on social media. Yet at the same time, I learned so much from social media science influencers. In fact, we work with some of them. And the truth of the matter is that, like, at this point, experts or expertise, that definition is changing. We may not trust Dr. So-and-so on the news channel. We may not trust FDA commissioner. We may not trust like people that we don't know in places we don't understand, but we would trust, like y'all said, our doctor. We would trust our friends. We would trust our family. We would trust an influencer on TikTok who is wearing scrubs and seems to have a lot to say about healthcare. And so going to that level is so, so important. And I see people doing their best, folks with very reliable and dependable credentials who are like, let me translate complex information for you. Let me use rhetoric that you vibe with, using references you understand. Heck, with Baltimore City during COVID, they were communicating using memes, and I love that. Getting information to people in ways that they really would take up. So it's not enough to have the expertise anymore. It's not enough to be like, all right, I put it out on the internet. It's enough. It's important to do that extra step of like, let me package it in a way that's honest, that is trustworthy, and you might actually read or listen to, or like a TikTok you might actually stay at and watch and like share with your friends. But obviously noting that it's a double-edged sword.
But I think it's a good point about plain language, right? Is that we have to use all the possible mediums that we can to reach people. And particularly our young people are on social media. They're on TikTok. They're on, well, not Instagram as much. They're Snapchatting and doing something I don't know. But, this shows my age. But it's important because that's there, like you just said, like there's bad. We're not going to deny that there's bad on those platform, but there's also a lot of good, and we can't throw out the baby with the bathwater, right? And so what we have to do is do what you've said, is how to explain to people, how do they decipher the good from the bad. We only have 3 minutes, and I do want to ask this question because I think it's really important. Well, there's two I have. I don't know if we're going to get to it in 3 minutes. One is, I do want to make us clear, because the basing on this vaccines is that vaccines are still available. I know there's also a confusion about that, about the recommendation, the schedule. Vaccines are still available. They're still being made. Doctors are still recommending them. How you get it, as I think Dr. Shirley said earlier, some states are requiring a prescriptions, most are not. Different, California, the Northeast states have done different things to make it easier. But I don't want people to think that this confusion means that vaccines are not available, right? They're very much available. They're very much recommended. They're just not recommended in the same way. And so I think what we do need to talk about is the impact this may have on, for example, insurance, if insurance is going to cover certain things, on communities, as Dr. Shirley started with, who have less access to begin with. Is this going to reduce their access? And particularly the communities that we care about here at the National Urban League, thinking about pharmacies, and we're already seeing pediatric offices saying, we're not carrying this vaccine because we're not too sure if we should be giving it at a certain time or not. And so I think I would like to talk about the consequences of that, because I think that's really important for us to try to end with like 1 minute left. Dr.
Yeah.
Nunez-Smith.
I'll quickly say, these are all excellent points. I think folks should be aware and have some degree of reassurance that the largest organization of health insurers, for example, has come together, and they are going to be supporting the vaccine recommendations sort of prior that were issued kind of prior to this time of flux. So you see a number of places sort of anchoring a little bit backdated in some of the vaccination scheduling, which makes sense, right? I mean, it's clearly moving a lot. And so picking that date and saying, whatever it was, as of September 1st, that's the vaccine schedule that they will be reimbursing. So I think that's really important, because how are you going to pay for it? A number of states across the country, we're seeing leadership put into place guidance, right, for pharmacies to be able to give these vaccinations without prescription. And so a lot of this is happening locally too. Don't forget your power, right? This is your power. I don't want you spending all your time reading these articles. Your power is to call your state, right there in your state legislature, right? Make sure that there is attention here, that these are the things that you're asking for, to say these need to be accessible, they need to be covered, we need to not have to have a prescription, right, to get access to what is really life-saving. So take your power to advocacy and do that. Everything you said is right. I worry a lot that even just the confusion, people won't even know that they can try to get vaccinated. So on a personal level, try. The worst thing to do is just say, oh, I don't think I can get it. And know that there's a lot of work and a lot of alignment around making sure that people still have access to safe and effective vaccines in our country.
Dr.
Yeah.
Nunez.
Sorry. Go ahead, Dr.
Oh, yes, Dr. Nunez-Smith, 100%. I tell you, when Lydia asked the question, I wrote advocacy, awareness down with the exclamation mark. I think this is definitely the time for us to really, really know that power, the power of reaching out with information, because I think our stories combined with really the cost of our local officials and our government officials doing nothing is very profound. So recognizing responding to outbreaks are extremely expensive for our government, and it impacts everyone at every level, right? So just small outbreaks, like we can just point to millions and millions of dollars in impact to our public health ecosystem and expenditures. And this is information that we can really state in combination with why this is important to us as a parent, as an educator, as a community member. I need access to know that my children and my communities are safe. Combining that with information, we are empowering our congressional members and our officials to really take this and move forward with it. I think that there are a number of different programs, so many, and we can share this in the resources as well too, where uninsured, underinsured, you still have access. There have been just pivots and ways that those experts that Dr. Nunez-Smith mentioned are really ensuring that we do not put ourselves in a position where we're seeing outbreaks and impact mortality because of access and affordability. So I would say let's just really look at those resources and really, really hone in on that essence of advocacy awareness. And I have a lot of resources about that as well too, and would love to partner with all of you on really engaging your state level officials and your local officials with information as to how to make those conversations powerful.
I would love to briefly add, so cosign 100%, retweet everything. And on top of advocacy with legislators, with folks who have the ability to make these decisions, I think it's so important, if we feel comfortable with it, for us to take on that responsibility as well of being the ones being responsible health communicators in our own personal circles. We're probably doing it in our professional circles as well, but in our personal circles as well. You might be the best person to get to your grandpa who says questionable things at Thanksgiving. Grandpa might listen to you when you say, hey, I have these credentials. This is what I know. Let's arrive at some shared values and then move towards a conclusion without judgment. And so I do want folks to feel empowered to just, first of all, do what they can, period, but also do what we can in our personal circles if that is a skill set we think we have, or then adopt that skill set. And then the second thing I would like to say is we need to move away from this, I need to win the argument. I have to be right. I don't think it's as important to be right. It's important to be first. So communicating what we can, what we know, what we don't know, and what we're doing to find out what we don't know is so important during times of uncertainty. But also, instead of being no, you're wrong, that has never worked. When you're in the trenches of Facebook comments and you're you're wrong, that's not going to work. What's going to work is shared understanding, building towards something in a compassionate, humble, empathetic, and just dependable manner. So I just want to encourage folks to kind of pursue that route as well.
Okay, I love that. Sorry, I got a coughing fit, but I'm going to get through it. Thank you all so much. We are 4 minutes over time, and I know you're super busy, but I think that was a wonderful thing to end with. You're not wrong. We have to come to a place together to think through what is best for your families and your communities. So this was a wonderful discussion. We could have spoke for 2 hours, I think, but we only had an hour and we're over time. Thank you all for being here. Thank you all for joining this wonderful panel. We will put the resources when we send it out. And everybody have a great day. Thank you so much. Bye.
Thank you.